How to cope with tinnitus. Tinnitus is a phantom noise, a ringing, buzzing, roaring, clicking, or hissing without any outside source. It is frequently caused by damage to the ear from noise, but can also be caused by ear infections, certain drugs, high blood pressure, and old age. Sometimes it will pass quickly without any intervention. Other times it will disappear after the treatment of an underlying condition. Other medications that can be delivered sublingually include steroids, barbiturates, opioids, vitamins, and minerals. Approximately 50 million Americans suffer from chronic tinnitus, a case that lasts for at least 6 months. Even in these extreme instances, there are ways to ease the discomfort. Treating tinnitus. Check for earwax. Sometimes tinnitus can be caused by excess earwax. A simple cleaning of the ear will reduce many of the symptoms. Your doctor can check for you and perform the necessary cleaning. Professionals now recommend against the use of cotton swabs for removing earwax. Washing out your ear with water will help, but if your wax is so severe that it is causing tinnitus, consider visiting the doctor for a professional treatment. Rule out head trauma. Somatic tinnitus is a ringing in the ears resulting from head trauma. This type of tinnitus is typically loud, varies considerably in frequency throughout the day, and causes problems with concentration and memory. Sometimes somatic tinnitus can be treated with surgery that realigns the jaw. Check with your doctor to determine if you have a vascular condition. If the tinnitus takes the form of a pulsing sound, in sync with your heartbeat, it is possible that it is caused by a vascular condition. Your doctor might be able to provide medication for this. In some cases, treatment will require surgery. Pulsatile tinnitus as described above can be a sign that you suffer from a serious health condition like high blood pressure, hardening of the arteries, vascular tumor, or aneurysm. Visit the doctor immediately if you hear a pulsating sound in your ear. Consider changing medication. A long list of medications have been known to cause tinnitus, including aspirin, ibuprofen, Aleve, blood pressure and heart medicines, antidepressants, and cancer medicines. Consult with your doctor to see if your medication could be causing your condition, and, if so, whether your prescription can be altered. Talk to your doctor about auditory dysfunction. Tinnitus is often caused by damage to tiny hair cells in the ear. Damage to the hair cell can be a result of aging or can be a consequence of being exposed to loud noises. People working with machinery or people listening to loud music often develop tinnitus. A short blast of loud noise can also lead to a temporary to permanent hearing loss. Other causes of auditory dysfunction include the use of certain medications, stiffening of the bones of the middle ear, tumors within the auditory system, vascular disorders, neurological disorders, and genetics. The severity of the disease varies and 25% of people report an increase in symptoms over time. Long-term tinnitus is unlikely to go away completely, but it can usually be managed. Discuss further treatment with your doctor. Tinnitus can be a minor, temporary condition. It is not always necessary to visit a doctor. But if you have a strong, sudden onset, it has lasted a week, or if it has begun to seriously affect your standard of living, visit a doctor. You should consider professional treatment if you begin to suffer from side effects like fatigue, trouble concentrating, depression, anxiety, or memory problems. Be prepared to discuss with your doctor when the sound began, what it sounds like, any medical conditions you might have, and all medications you take. Diagnosis is made on history and physical examination as well as a hearing test. A patient may also need an CT or MRI of the ear for other pathology. Management involved treatment of the underlying pathology. This includes depression and insomnia. Tinnitus retraining therapy, masking, biofeedback and stress reduction may also be part of the treatment plan. Be prepared to discuss with your doctor when the sound began, what it sounds like, any medical conditions you might have, and all medications you take. Diagnosis is made on history and physical examination as well as a hearing test. A patient may also need an CT or MRI of the ear for other pathology. Management involved treatment of the underlying pathology. This includes depression and insomnia. Tinnitus retraining therapy, masking, biofeedback and stress reduction may also be part of the treatment plan.